Hello, everyone. I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the November 30th, 2020 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total has climbed considerably, with 1,180 cases reported in the last 14 days for a total of over 9,200 cases. Even though our 14-day average positivity rate has declined to about 17%, keep in mind that last week we had less testing available due to the holidays, so that clearly affected our number of positive cases, and we will see lower cases for the next few days. Likewise, hospitalization numbers have declined, but do not consider this a long-term trend. The surge in cases over the past several weeks is likely to produce continued higher levels of hospitalizations and, unfortunately, ongoing deaths. Dubuque County has experienced a total of 91 deaths during this pandemic. Again, similar to hospitalizations, deaths happen weeks after initial infection from the virus. All Dubuque County deaths have been in individuals 50 years old or greater. In Iowa, 3% of deaths are below 50 years old. With all these statistics, the incident management team is aware that although we've declined in some of our data points, the cases reported in the next 2 weeks will indicate the level of spread that occurred over the Thanksgiving holiday. Which brings me to my next point. You may have noticed I'm in a different format for this update. It's because I'll be working from home for about 14 days since I was with non-household members over the Thanksgiving week. Primarily, my sons who attend college and live outside Dubuque. Although they practice the basic public health measures to prevent infection, I'm following the guidance I give all of you. When in doubt, or when you've been spending time around others, particularly those from different households who have not previously quarantined, if you've been around them without masking or maintaining the 6 feet of physical distancing, it's best to quarantine for 14 days. Remember, quarantine is what you do when you are not yet infected, but may have had a potential exposure or an actual exposure. And the reason it's 14 days is because it takes the maximum time of 14 days to develop an infection with COVID-19 after an exposure. Now, let's say you've started quarantine based on your holiday activities and potential exposure, and then develop symptoms of COVID. That's when isolation kicks in for a period of 10 days from the onset of symptoms or a positive test. So in other words, when you're sick, you isolate. When you're exposed or potentially exposed, you quarantine. So if you're experiencing symptoms and have started isolation, it's a good idea to get a COVID test at this point. Also, it's a good idea to get a COVID test if you've had a known exposure to a positive case, for that matter. If your test is positive, continue to isolate. In other words, stay home for at least 10 days from the day your symptoms started or the date of the positive test. And you should also be fever-free for 24 hours, and your symptoms should improve. So remember, quarantine is 14 days for an exposure. Isolation is a minimum of 10 days when you're sick and or test positive for COVID. On another positive note, we continue to get good news on the vaccine front, with several manufacturers being on the FDA's meeting agenda to request emergency use authorization. The developing vaccines are showing high efficacy rates of 90 to 95%, meaning they prevent disease in that percentage of people in their phase 3 trials. The incident management team continues to receive information for vaccine distribution planning, but we don't have definitive dates or priority groups yet. Dubuque County hospitals, clinics, and healthcare providers in general have done extremely well in signing agreements with the state for vaccine administration and distribution. So the planning is well underway. Virtually visiting with friends and family this weekend, I've learned many of you stayed home and enjoyed quiet and more immediate family-type Thanksgiving celebrations and didn't put elderly or vulnerable friends and family at risk. I commend all who sacrificed their normal extended family gathering Thanksgiving Eve going out, open houses, and in-person Black Friday shopping. And a special note to thank the retailers who did not limit their Black Friday sales to one day, so we didn't have to attend crowded stores to get a good deal. This will be good practice for the next round of December and New Year's holidays. And we may learn some valuable lessons in the next couple of weeks as we watch the number of new COVID cases. We'll learn that not getting together in large groups and mixing other households helps prevent infection. And some of us may also learn that exposure to others who aren't yet sick with COVID symptoms may lead to an infection. Either way, December and January will continue to challenge us and our ability to do all the public health measures we've been hearing about and practicing since last spring. Please hang on and don't let your guard down. Community spread will continue to seek out the people who have not yet been infected with COVID-19, which is about 85 to 90% of the population, no matter who you are. Have a safe and healthy week because we're all in this together.